And you are live.
Good morning, everybody, and welcome to the Chamber's annual State of the State Forum. Excited to have you all joining us. Thanks for being here. We're very fortunate to have Governor Sununu joining us again to share an update in his State of the State. Great timing as there's a lot going on right now. Legislative sessions underway. Of course, we're still working our way through the pandemic and a lot of important topics to get to. Before I dive in, just a few quick introductions. We have a ton of Chamber board members joining us this morning, so I wanted to quickly recognize them, as our Chamber board is a critical part of making sure that our organization is moving forward and fulfilling our mission. Nathan Saller from Bellwether Community Credit Union, our board chair, is on, as well as Anna Thomas from Manchester Public Health, Bill Brewster from Harvard Pilgrim Healthcare, Diane Fitzpatrick from the Boys and Girls Club of Manchester, Donna Gamache from Eversource, Ernesto Burden from McLean Communications, Janella McDonald from Stibler Associates, Holly Blanchard, who's our Young Professional Board Liaison from CHAD, Joe Raska from York IE, John Kakavas from Dartmouth-Hitchcock Health, Chris McCracken from Amoskeag Health, Matt Cookson from Cookson Communications, Mike DeSell from UNH Manchester, Paul Mailhot from BioFab USA, Preston Hunter from Ekman Construction, Sheila McNeil from Whitfleet, Ted Kitchens from Manchester Boston Regional Airport, and Trini Houghton from Sojourn Partners. So thank you so much to all of our board members for being here. Great engagement and representation from our Chamber leadership. I'd also like to take a moment to recognize our sponsors, without whom all the work that we do and programs like this would not be possible. Our presenting sponsor is Dartmouth-Hitchcock Health. Our corporate sponsor is Eversource, and our advocate sponsor is New England College. I'd like to welcome Dr. Joanne Conroy, who's the Chief Executive Officer and President of Dartmouth-Hitchcock Health, to say a few words as our presenting sponsor. Dr. Conroy was named President and CEO of Dartmouth-Hitchcock Health in June of 2017. She previously served as CEO of Leahy Hospital and Medical Center. And she was named as one of the 100 most influential people in healthcare by Modern Healthcare in 2018. Dr. Conroy, thanks so much for your continued support and welcoming us this morning.
Thank you, Michael. I'm honored to join you and the members of the Greater Manchester Chamber of Commerce this morning. It's hard to believe that 13 months ago, on March 1st, 2020, I, along with a small group of hospital leaders, met with Governor Sununu and the entire federal delegation at the New Hampshire Hospital Association facility. Other states across the country had been grappling with positive COVID cases and increasing numbers. And we knew it was just a matter of time before New Hampshire had its first case. At that time, we had an individual under investigation whose tests had been sent to the CDC. It's hard to believe that back then we sent all of our testing to Atlanta and waited over 48 hours for the results to come back. Coincidentally, while we were in that very meeting on March 1st, we received confirmation that New Hampshire had its first COVID case, and it actually was the first COVID case in New England. Back then, I'm not sure we could have imagined the hurdles we were all about to navigate. Over the last year, we have experienced unimaginable disruptions in our supply chain, from personal protective equipment to essential parts for medical testing. And I bet many of you didn't know what PPE knew 13 months ago, but we all know what it means now. Getting what we needed was an incredible challenge, but we met that challenge with help from you. The business community stepped up and started making face shields for us, donating hand sanitizer. They brought food to nourish our frontline workers. We want to thank all of you for the support and the support that we got from the communities from around the state. It was really humbling to see that. In the interest of public safety and at the urging of the U.S. Surgeon General, we postponed elective procedures and visits from March until May, and we are still working on recovering from that dramatic shift in business. But despite the challenges that COVID-19 presented to clinical care in 2020, we continued with our plans to meet the needs of our patients and our communities. Our new ambulatory surgical center will open at 100 Hitchcock Way in Manchester next month and will provide outpatient surgeries with 23-hour extended stay capabilities, really expanding the types of procedures that can be done on an outpatient basis. The expansion project will also allow us to provide better access for primary and specialty care patients in the southern region. In addition to the building is a remarkable space with patient care areas and operative and procedural suites that will elevate and define the highest standards of patient care in the region, as well as being an ideal place for our teams to work and collaborate. I appreciate that healthcare was not the only sector that encountered challenges and disruption due to COVID-19, and many of you are still challenged trying to balance public health and safety and economic viability. It's been tougher than any of us could have imagined, but like other businesses in the greater Manchester area and around the state, we have been supporting our employees, patients, and communities while we all work through these challenging times. At home, our team members who are working remotely are still juggling their job duties online or hybrid school for their children and childcare needs. At work, in addition to everything they normally do, our employees continue to carry out enhanced protocols to ensure all patients are able to receive services safely. And while we have all felt the strain of the pandemic, we are all feeling more hopeful with the rollout of the vaccines. Last week, Governor Sununu announced that all Granite Staters who are 16 and older will be able to register for their initial vaccine appointment by this Friday, April 2nd. In fact, now all persons 30 years old and up can register for their initial vaccine. While it is still essential that we continue to mask up, we also know that a robust vaccine rollout will bring us closer to moving beyond the pandemic. Like all of us, COVID-19 has not slowed the state's work. We know the House is working on the budget that Governor Sununu sent to them in mid-February. We also know that New Hampshire is set to receive another $1.25 billion in relief funding provided by the American Rescue Plan. I'm eager to hear from Governor Sununu about his plans for our great state. Thank you all for inviting me to be part of the State of the State Forum this morning, and now I'll turn it back over to Mike.
Thank you again, Dr. Conroy, for your partnership and support of the Chamber in this program. And I did want to make a special note to all our members out there that I'm broadcasting today from the Dartmouth-Hitchcock Health Collaborative Hub here at the Chamber's office, which is a new addition to the Chamber HQ that we're eager to share with everybody once we're ready to get back to more in-person activities. But in the meantime, it makes a pretty cool backdrop for broadcasting virtual events. All right, so let's get started. Our format today will be a free-flowing conversation with the governor. We very much want to encourage all of you to ask questions. You can use the Ask a Question feature down the bottom of your screen. Audience members can upvote on questions to make sure that we see them and we can get to as many as possible. I have some prepared questions as well, but certainly want to invite everybody to ask questions. Please use the chat. Everyone's already been very active in the chat, which is great to see. I know normally this is a great networking event for everybody. So please catch up with friends there. And our Chamber team is on call and can assist with any issues that you're having. So Governor, I'd like to start and kick things off and get as much time as we can to chat with you. Normally we'd be asking you to give a formal State of the State address, but I think it would be best and probably your preference if we had more of a free-flowing conversation. And so I'd just like to open things up with a general question of how you feel things are going right now, where we are as a state, both in the context of obviously the challenge of the last year, but the looking ahead and some of the things that you're working on with the legislature and elsewhere in other capacities in your role as governor.
Sure. Well, thanks again for having me. And I love that we can just jump into this discussion. I say all the time, we can all write our own stories on COVID, right? How it affected our families, how it's affected our business, our work life, our socialization. It's been a tough year for everyone and no one has been immune. So we've all lived that. Look, it's not just the governor sugarcoating anything. We're in a really good position. We really are. We're the first state in the Northeast to offer vaccine to everybody. It's rolling out really fast. We had folks signing up Monday. We had folks signing up this morning, and the 30-ups that are literally getting their shots this afternoon. So because that process is going so well, so fast, it just means we're going to come out of this with the final restrictions. We don't have many restrictions. We have our mask order and a few small restrictions on businesses, but we already have the most flexible, strongest economy in the Northeast. Every indicator shows that. But we're also going to come out of this faster than anybody else in the Northeast. And that's just going to kind of provide that rocket fuel, if you will, to making sure that we are going to have a very successful summer. In the short term, I think things look very, very good in that, we call them the Biden bucks, right? Everyone's getting their $1,400 stimulus checks and whatnot. There's going to be a lot of kind of micro localized investment, where there's people taking vacations or people spending money on home projects or whatever it is. And so that's going to be a big boost to, I think, the economy in the short term. We can talk about the macroeconomics of having to manage and pay down $2 trillion that they just spent. But there are some needs out there that are being met with these dollars going in. We have a lot of opportunity at the state level. I provided my budget a couple months ago, which again is balanced. It still has tax cuts for everybody. It provides a lot of revenue sharing, if you will, to cities and towns and businesses. And when you add that on to what we did with the CARES Act, we spent more money, not per capita, more money dollar for dollar than any other state with our CARES Act money into small businesses. California didn't spend dollar for dollar as much as we did. Nobody did. We did that very consciously because we knew in tough times when you support businesses, when you support the economy, when you support the market, if you will, and not just put your dollars into big government, it's a rising tide floats all boats. And that is why I think we're in such a strong position today. I think we were one of the few states to do that. We broke from the pack a little bit, but it put us in a much, much stronger position. And I think the team, Gopher especially, and working with our office, did a great job just creating some innovative programs. We're one of the few states to already invest in broadband infrastructure. We put thousands of people onto high-speed internet that barely had dial-up access last year. We were one of the few states to do things like the Main Street Relief Fund, the Self-Employment Fund. I think we're the only state in the country to actually do a self-employment fund with our CARES Act money. Those are employees. Those are strong parts of our economy, and we need to support those. So we tried to do the real spectrum of supporting businesses. We did a lot for our nonprofits. Not only do nonprofits provide incredibly vital services on the front lines, but they employ tens of thousands of people too, hundreds of thousands of people, frankly. So, by supporting them, it's supporting the economy. And so I think that's just given us the opportunity to be where we are today. You combine that with what we did with testing, with PPE. We've gotten really good at PPE. It's amazing. And obviously now we're incredibly good with the vaccination rollout. Those are all those things are kind of matching together at the right time so we can be more flexible, get rid of a lot of these last restrictions, and just frankly have a great summer.
So I want to pick up right there and have a few more questions about the pandemic and kind of where we are right now. On the vaccine deployment, which I think has been rightly on everyone's attention recently. Actually, I can share, I was able to sign up, my wife and I were able to sign up this morning quickly, easily. So the system really does seem to be working quite well. And I've heard that from lots of other folks. I know you have put out there and other state officials have put out there the goal of really by Memorial Day, by the end of May, having the opportunity for everyone who wants to get a shot could have gotten a shot. Do you think we're on track to do that?
Way ahead. Oh, we will be way ahead. I think everybody who wants a first shot by probably first week in May, be able to have at least the first shot. And then we have more Johnson & Johnson vaccine coming. Keep your eye out. We've designed the system very intentionally to allow people to move up. So let's say you're getting your first shot in May. Keep an eye out. If we do a super site and you can go in, change your appointment in a matter of minutes without the risk of losing your old appointment. You can now change your appointment and move up. And we encourage people to constantly look, spread your radius. Don't just look within 5 or 10 miles of your home. Spread your radius to 100 miles. I guarantee you're going to find, if you're getting a first shot in May, you're going to find an opportunity like next week. I was on the site last night, and you could get shots in Claremont like tomorrow. If you're willing to just drive another 10 or 20, 30 miles, you can just move yourself way up in the system. And so that was very intentionally designed with that flexibility. And I think we're going to crush the Memorial Day deadline we originally gave ourselves. We have about, just to give you 40 to 50, we have about 150,000 people in that category. 30 to 40, about 150,000, and 16 to 30, about 150,000. So about there's a good portion, maybe 20% of each of those populations has already actually gotten the vaccine because they're police officers or nurses or healthcare workers or teachers or whatever it might be. Maybe about 50,000 more in each of those populations will sign up over this week, which means in this week, we're going to sign up effectively the last 150,000 folks that are choosing to get the vaccine. Now, we want everyone to get it, of course, but that's just roughly where it will pin out. But we literally have 300,000 spots available until Memorial Day. So that tells you huge opportunity. Constantly check the system, see if you can move yourself up. We're going to get through this really fast. And that gives us the ability to get rid of a lot of these restrictions.
You touched on that. Of course, the vaccine is, everyone can make that choice for themselves, but that I've heard you say at some of your press conferences that, very safe, effective vaccines. It's really a huge accomplishment from the scientific community that we were able to do this. What would you say to someone out there, just based on all that you've heard from Dr. Chan and the other experts that are around you, that if someone was, vaccine hesitant, they're open to it, but they're just worried and they have questions or they're unsure, what would you advise them to do? How should they go and learn more to get comfortable with making that choice?
Sure. I think the federal government, starting back when it first came out in December and January, I think that the Trump administration, or I'll just say the previous administration, I want to pit Trump versus Biden. They both have good successes and they both have different issues on communication. It's still the federal government. It never works very well for anybody. But I think both administrations have tried to do a lot on the federal vaccine website, where there's just a whole host of information. You can get into the deep data. You can look at the data, whether you're a young woman who thinks that she may want to get pregnant. Will this affect them with pregnancy? If you're older and have other health conditions, how do the vaccines potentially affect other health conditions? Overall, they're all very, very effective, and they're all very, very safe. We've had some small cases of anaphylaxis, or people might get a small allergic reaction in their arm or some redness in the arm. That's typical of a lot of different vaccines. Overall, the rate of those instances is far even below what they originally anticipated. So it's just been very positive. All the initial data looks very, very positive. And so people should feel comfortable with it. We're not mandating it, of course. We just want those who are willing to protect themselves and want to protect themselves to have the ability to do that. And that allows us. And if folks want to take the risk, the chance, and not get vaccinated, that's completely their choice. But we're moving on. And so they'll have to carry that risk and have everyone else be vaccinated. And those folks can feel like they're not putting themselves at risk when they go to a restaurant or go to a movie theater, whatever it might be.
We have a number of questions coming in, so I want to get to those soon. But one, I just asked to we're about 1 year later from when this really accelerated and clearly became an emergency for the state. I'm sure it dramatically changed your job as governor day to day. Looking back, over the past year, is there anything that you feel we could have done better, or would have changed, or things that you've learned along the way that I think here in New Hampshire we're pretty grateful that we didn't experience a lot of what happened in other states where the virus was much more widespread or accelerated. But just looking back over the past year, kind of lessons learned, and then looking ahead, of course we hope and pray that we're not going to have to deal with anything like this for a long, long time. But, how should we be prepared as a state looking ahead for situations like this going forward?
Sure. So I think to your point, we really had to kind of write the playbook as we played the game. And it was a new game that no one had ever done before. It was very scary for a lot of folks. We made the decision early on that we were going to have to make decisions and own decisions that were to potentially upset everybody at some point in time, right? There was going to be no good answer to a lot of this because everything we did was just going to have to be so disruptive to people's lives, unfortunately. And we had to own that. Transparency was a huge issue in terms of making sure that we were, what we knew, you knew, right? And that's why I was doing all those press conferences, because I never wanted anyone to say, hey, you kept something from us, or what did you know when? We let the press ask every question they had on every day. We never cut them off. My goal was to exhaust the press, right? To kind of outlast the press every single day, and we did. But that's an incredibly powerful tool to have with public trust and that communication. That was very important for us. And when the press asks questions, that allows us to kind of get the feedback of what are the anxieties out there. What having kind of that connection of empathy, making sure that if we're trying to fix something and make it better, it's really dealing with the anxieties and the barriers that are currently people are dealing with in their homes or in their businesses. So that kind of communication transparency was really, really important. Early on, there was no testing, there was no PPE, there was nothing. And so we had to really rely on the federal government. We didn't have a lot of choice in the matter. And frankly, it was unfortunate because FEMA was a mess. It still isn't great today, frankly. It hasn't gotten much better. They don't communicate well. They don't understand about you have to set appropriate expectations. You can't just tell people what they want to hear in the moment and then just figure it out and come in short later in a crisis. Just the opposite. You need to set appropriate expectations that you can meet, because otherwise it exacerbates the situation. And the federal government really has never understood that. Not in the beginning of the pandemic and not today. They set very bad expectations. We then design systems as governors based on those expectations of what we're going to get, the PPE distribution, whatever it might be. And then when they don't come through, we're left holding the bag. And so we scrambled a lot and we're able to create a lot of opportunities, specifically around PPE when you just couldn't get it anywhere. And we got very good at bringing it in from overseas. So good that we're now still the number one provider of PPE to the U.S. Veterans Administration. We just got it so fast, they buy it from us. Mm-hmm. Convoluted story of how messed up Washington is. They can't cut the deals that I could cut. So I would get the deals from the PPE overseas, and they would buy it off of me. A really bizarre situation, but the federal government really was very messy in this whole situation. They're cumbersome. They're clunky. A big top-down answer to a crisis is never the right answer. You really need that local touch, if you will. And I think that's where governors and mayors, I think, did a very good job. So in terms of lessons learned, I think if anything, it's to be self-reliant. To the last half of your question, we have a 3-month PPE stockpile. We have it. It's ready to go. We're going to keep it fresh. Ultimately build our stockpile of vaccines just in case, right? So you really need to use some of the opportunities and dollars that we have today to build reserves and plans and strategies for the future. How we handled the H1N1 vaccine distribution a few years ago and how we handled this is there are some similarities, but some differences. There's definitely some lessons learned in terms of vaccine distribution, although we did it really well, frankly. We have this new system, Vinny, that we could always pull out and use for any future situation, which is great. So we've been able to build a lot of infrastructure for the future. Doesn't mean that we're going to, just sail through any future pandemic if it were to hit, but we're clearly much more prepared. We've got a great playbook now, always challenging ourselves to not just learn the lessons, but actually operationalize to them.
Great. All right, so we have a bunch of questions piling up in the chat, so I want to start getting to a few of those. I did want to mention on the PPE, the success story here in New Hampshire. Recognize, I think one of our members, Dean Kamen from DECA, is joining us today, and I know he was a big partner of that, so we're very proud of their work here, a local partner.
Could not have done it without Dean. Nothing happened. None of that success happens without Dean and Fritz and his team, his partners overseas. They were the absolute conduit, and the entire state of New Hampshire owes Dean a huge thank you. I mean, really.
So on PPE, a question about the mask mandate, and this is from a business owner. It says the mask mandate has been a real blessing for them and taken the strain off of their frontline staff having to enforce their own kind of restrictions or regulations, and just wondering about what your plans are for lifting those restrictions as we get into the summer, and you may have visitors who, their vaccination status is unknown, and just kind of what your thinking is around that restriction and specifically some of the others.
Sure. I appreciate there's a lot of businesses who had to face, when we didn't have the mask mandate, having their employees enforce their own rules or whatever it might be. The mask mandate is going to go away. There's no two ways about that. And people want it to go away. And we are vaccinated, right? We're getting ourselves vaccinated, I should say. And so all of that will kind of gel together. If we are protected and we're vaccinated, as we should be, and we've done it quickly, if other people were to come into the state and not be vaccinated, or our own citizens are not vaccinated, that is going to be a reality. So we can't have a mask mandate until the last needle is in an arm. and we're not going to force people to mandate that people get vaccinated. So at some point, we have to understand that maybe 30 to 40% of our population is not going to be vaccinated. They're just going to choose not to. And so as long as we're protecting those who are willing to protect themselves and allowing that opportunity to happen, that's what dictates getting rid of the restrictions. We're going to have COVID. We're going to have high cases of COVID potentially for a long time. But again, if you're protecting the most vulnerable, those cases of COVID are now with individuals that have just chosen not to get the vaccine. That's their choice. And they have to walk with that risk. The rest of us are getting on with the rest of our lives, and we just have to do that. So it's really, the vaccine is the key to all of this, and we're just getting out so fast. I suspect that the mask mandate, I mean, we look at I'm not picking a day, but we look at the data every day, and I can tell you it could be weeks away, frankly, of getting rid of the mask mandate. We're just moving that fast, and that's a very good thing.
So a question about the public health system here in New Hampshire that, the National Guard has been really an invaluable tool for the state in fighting the pandemic, and kind of retasking them to help support all of the activities the state has been doing. But thinking kind of long-term, is that really a long-term solution? And recognizing that New Hampshire has only 2 local governmentally run comprehensive local health departments in its 2 largest cities, moving forward, do you think the state will reevaluate what adequate local public health infrastructure should look like to deal with situations like this? Situations like this are temporary. I mean, it was a long temporary. It was a good year plus ultimately. But and the National Guard stepped up. We had the nurses and the doctors and the first responders, the firefighters that have helped out in the vaccination process. It was just a massive undertaking, and we got it done. So I don't know if the state has to reevaluate its entire system based on a hopefully once in a lifetime pandemic. I think we have a very robust system. We have a system where we can bring up volunteers very quickly. We can bring up our National Guard very quickly. We can mobilize folks in a variety of different areas. A lot of folks in the private sector stepping up to help with our call centers or stepping up to volunteer, their spaces, their services, their parking lots for vaccination, whatever it might be. So I think our system is in a real good place where we don't need to build bigger government and we don't need to build bigger systems to deal with the pandemic. We need to build resiliency in the system that can flex and respond in those times when we need it the most. And we've been able to do that, I think, very successfully. So I'm not looking for any significant changes per se, because you never want to create a system for the long term based on the crisis of the moment. You can build resiliency, of course, and flexibility, but you don't want to create the long-term system to be rigid to the individual moment. But I think we've managed that pretty well. There's a question or two specifically about the state budget, so I wanted to dive into that, but start with kind of more of a broader overall question that you shared last week in one of your press conferences, your thoughts on where the process was, and I think gave a frank assessment that things in the House had moved kind of off target from where you thought they should be, and that you were hopeful in the Senate that the process would get back on track and focus on priorities that you think are important. So I wonder if you could share with everyone again, what do you hope the Senate process looks like, and what are your expectations for moving ahead and working with the Senate on the state budget?
Yeah. Well, yeah, it's no secret what the House has done with the budget is a bit silly. It's gone out completely off the rails. It's not balanced. It's not conservative. It has all this other non-germane stuff thrown in it. It's just a bizarre process. And so I have a lot of faith that the Senate, Chuck Morris and Jeb Bradley, Senator Aaron Hennessy up from Littleton. I mean, these folks have done, I think, a great job of understanding what budgets should look like, how they look, make sure that they're balanced and still provide the tax cut opportunities that my budget proposed, and maybe even more. Who knows? I'd love to see more tax cuts. I mean, that would be great. We provided a lot of tax cuts, a little bit for everybody's, the business tax cuts, the meals and rooms tax cuts, the interest and dividends tax cuts. All of these have huge impacts into our economy and creating opportunity. And that's why businesses want to be here. Families want to move here. The real estate market is going crazy. because I think that people are understand what we're doing, what we have done, and want to be part of that future, which is really great. But yeah, a lot of it will rely on the Senate and working with them to actually get things back on track, whether it's just taking my original budget and moving forward with that. And they can make adjustments there, of course, but they've got great experience with it, and they tend not to play the political games that the House does.
So a couple specific questions that have come in on the budget. One, the first is in your originally proposed budget, the Film Bureau was defunded and also eliminated from statute. Can you talk a little bit about what was the thinking behind that? And I know there are several folks in our region that really believe New Hampshire has the potential to grow its film business as an economic driver.
Yeah, so when I first became governor, I believe that too, by the way. And when I first became governor, I tried to make the Bureau bigger. The Bureau is literally one individual. It's one guy, and he's great. But we tried to pass some bills and create some tax incentives, some tax breaks, things like that to drive more film and media into New Hampshire. I'm a big believer in it. They wouldn't pass it. For 4 years, I've tried doing that. So we're at the point where we just kind of have this position languishing. It doesn't really do a whole lot, unfortunately. So we've tried to make it bigger and more robust. And right now it's just kind of languishing there. So we can take a lot of the few permitting opportunities we have and kind of meld them more into just directly into the Department of Business and Economic Affairs, as opposed to having a position dedicated to it. So it's one of those things where either you go and you do it the right way, or you just need to kind of move on, assimilate some of those opportunities back into the office. It doesn't mean you can't film here or get permits here. We're just going to, I think, streamline it a little bit. But I still, if the House were in the Senate the legislature were to look at this the right way, and I think see the economic opportunity that can come by making those types of opportunities bigger and better, I'm all for it, 110%. We tried for 4 years, it wouldn't go. So now we're just getting rid of the title position, if you will, but all the operations are still just molded into the Department of Business and Economic Affairs.
Another proposal from your original budget was a reorganization of the energy functions at the state level and creating a Department of Energy. Energy cost, building energy infrastructure has been a big priority of our organization for a number of years. So it's of interest to us, and just wondering if you could share a little bit of how you see that reshaping kind of energy policy of the state, and why you think it would be a positive step forward in our ability to, build more renewable infrastructure, but also build infrastructure that can help us lower costs.
So right now we don't have a Department of Energy. Our Public Utility Commission has two functions. They're essentially 3 judges that rule on policy, and then they manage what is effectively the Department of Energy that helps drive policy. So there's an inherent massive conflict of interest there, right? They're managing a group that is helping drive policy on policy that the private sector then has to come and advocate for one way or the other, and they have to rule on. So I think everybody agrees this is a bizarre system. You should create a Department of Energy that does those things like, that looks at investment opportunities and infrastructure and lowering rates and all that good stuff. And then you have the Public Utility Commission that sits as a bit of a judiciary body that can help rule and make sure that we're not overly impacting and overly burdening the ratepayers. So it's more being done out of just common sense, avoiding the conflicts of interest. But it also does create opportunity, right? Because when you get rid of conflicts of interest, each of those independent groups as in a more of an independent manner, I think can be a little bit more robust about where we're going. New England, as you know, we're at the end of the pipeline, literally, right? So we typically in New England have some of the highest energy costs in the country. New Hampshire has the lowest energy costs of anybody in New England. The key there is not, I'll just be blunt, not doing dumb things, right? Not saying yes to bad legislation that would keep driving rates up. And I've vetoed a lot of bills that would have driven rates up on low-income families and seniors on fixed incomes. You cannot drive rates up on them with this stuff. There are good projects, there are bad projects, and you have to have the courage to say, this one makes sense and can lower rates. This one is just too expensive for today. There's no return on that investment. And I think allowing these departments to be separated and creating a real Department of Energy will give us a lot more ability to look at the data and look at the numbers and just keep making those really good decisions. Again, we're in a tough position because we're in New England, but we're in a great position because we're in New Hampshire.
Another question on not necessarily a budget-related item, but one that is in the pending legislation realm is around housing affordability, workforce housing. And I know it's an issue that you've spoken about and taken action on in terms of sponsoring some commissions and work groups to look at different proposals. I wonder if you could speak just generally as to why you think this is an issue the legislature should act on. It's certainly an issue from our chamber's perspective we think is important. And we had someone ask specifically in the chat about what the state can do to address this. That for many families, including a lot of young professionals, young families, when you add up rent and childcare, it's can eat up a huge portion of their take-home income, which really, then presents challenges about being able to stay in the workforce and live in our state and be part of attracting and retaining that talent that we want to keep here.
Sure. So I'm going to take it a little further. I got to be honest. I'm not sponsoring commissions and study groups. My bill that I put forward on housing looks at everything. It doesn't look at, but would have implemented tax incentives for developers, incentives for cities and towns, for permitting, appropriate workforce housing, education for the planning boards, education for individuals about how to get this done the right way, not the old school way, but in a more modernized way to really address it. You cannot say you're pro-business and not be pro-housing. You can't have it both ways. Businesses need employees. We have 3.3% unemployment. And one of the biggest barriers in driving young people back into New Hampshire, even though we're doing it fairly well over the past couple of years, the biggest barrier is housing. And you have too many local communities saying no for the sake of saying no. So we're trying to create those incentives with a carrot, not a stick, if you will, for folks to jump in. They've tabled that piece of legislation. I think that's a huge mistake, frankly. I hope either the Senate takes it up or somebody takes it up as early as next year, because it's substantive. And we're very proud. We work with developers. We work with local communities. We work with all the folks that were kind of in that barrier, right, that were part of the process, but it kept breaking down. See, the key to this is a great example. The key to good government is being able to go to a localized level and saying, where did the system fail you? Why aren't there more apartments in this area when you have a business that's trying to grow by 300 employees and young people can't find a place to live? That's a breakdown of the system. So where is it breaking down? So we brought developers in and planning board members in, and we got a better understanding of that. And then we created the legislation from that, not to study it, to do it, to actually make some things move forward. A lot of folks are just unwilling to do it. And so we couldn't get the votes where we needed them, I guess, in the House process. But it's not completely dead. We would like it to come back. But housing is absolutely critical. It's one of the biggest issues that we have here. And if we are a local state, a local control state. I believe in that very much. As much as governor, I'd like to just put my thumb down and tell everyone you have to build this kind of housing. We don't do that like Massachusetts does. So I believe in local control. And I believe if folks just stop thinking like it's 1995 and start realizing it's 2021. And if you want these employers to be there and you want that strong tax base, you have to build the housing that supports the manpower and the employment power, if you will, to get it done. And it's hard. It's amazing to me, some of the bad decisions that are made at the local level. But that's New Hampshire. We've been going through that for 200 years. I've been at a lot of town meetings. Everyone else has as well. Sometimes you walk out scratching your head about what just happened. It happens, but it doesn't mean you give up. You keep fighting for it. You keep making the case. You keep bringing the data forward. And eventually, I think you can get a lot of this stuff done the right way.
Well, thanks for sharing that. I think you will find broad agreement from our chamber members about that being a huge priority that we need to move forward on. I want to ask you kind of a side question on that I think is one of the, as I talk to business leaders, one of the most interesting and potentially transformational trends coming out of this, which is remote work. And that, so many industries have discovered through the past year that remote work is a potential fit for their business. And it's going to stay in some, it'll vary business to business, industry to industry, but it's going to be part of their playbook going forward, which means people have more choice on where they live, irrespective of where their job is potentially located. And that could be a great recruitment tool for New Hampshire, because we already have all the amenities in place. And, so we've been talking as a community here, and I know Commissioner Caswell has been talking about this up at the state level, that, this remote work trend could be a real workforce strategy that could be a boon to the state. And, so one, your thoughts on that, but then I think that underscores the importance of, if we're going to start attracting remote workers here, we need to also have the housing. So we not only need the housing for the people we already have here, but if we're going to take advantage of that economic opportunity it really does matter if we're going to capitalize on this trend.
Absolutely. And I would add broadband to that. That's why I'm so aggressive about trying to put more broadband into the ground, into rural communities. You have a lot of young people moving into Littleton and Bethlehem and Lancaster and places up north that for a while weren't getting a lot of influx, but now they are. And if we keep making those, not just housing investments, but broadband investments, because this next generation really wants that robust quality of life, a full spectrum of being able to, to be in the environment, to be hiking and fishing and skiing and having that great quality of life, but still having the connectivity so they can work for some of the big companies in New York or Boston, whatever it is. So we're making the right investments. We have the infrastructure. I think Taylor does a great job. He and I work very closely on how to sell it, if you will. And I mean, we got the billboards and the ads and the social media campaigns running in New York right now, and DC and Philadelphia and Canada. We're bringing a lot of folks out of Canada. But that paused a little bit with COVID, but there's still a lot of opportunity because a lot of those businesses want to be right here. A lot of them want to be in Grafton or Coos, not just in downtown Manchester, and that just makes the entire state stronger. So that point is not lost on us. If anything, we were looking at it about June of last year as we started flexing open a little bit and really saying we had to capitalize on the opportunity to advertise, to promote New Hampshire, and look at the result. I mean, typically, here's a good stat for you. In the month of February, for the last 5 years, we average about 3,700 homes for sale. I think as of last week, we had about 900 for sale on the market, right? So the real estate market is going 3 to 4 times what it normally does. And things are being sold for anywhere from 20 to 250% over market value. It's just incredible what's happening. So it's clearly, what we're doing is clearly working, but really we want to that last piece still is the more workforce housing, the availability of that rental housing, if you will, or the small condo, or what we used to call a starter home, that kind of stuff. That's the kind of product we need a little more robust spectrum on to get that next generation of worker to be here.
So we have a number of other questions in the chat here that I want to cover before we run out of time. Would love your thoughts on the proposed infrastructure bill being talking about in Washington and Congress. How would you think that might impact New Hampshire, or what would you say would be your priorities in a infrastructure bill like that you think are important for our delegation to consider, or Congress should be looking at in terms of how small states can take advantage of this?
So let's take a step back and realize we just passed another $1.9 trillion. A lot of that has infrastructure and capital projects in it. About $1 billion is going to come to New Hampshire. About $500 million is going to come to cities and towns for similar type projects, for water projects and dams and wastewater treatment and broadband. That's all outlined in what has already been passed. So we don't even know the rules on how to spend that money. So I'm not against an infrastructure bill, but we haven't even spent $1 of the bill they just passed. The inflationary problems that this is going to create, it's a lot of opportunity, but let's not be blind to the inflationary and the tax problems that it's going to create in the long term. So I think we have to really figure out what the rules are and start spending the $1.9 trillion before we start talking about another $2 trillion. What problem are we trying to fix with the next bill that we haven't fixed with the current bill, right? We don't know. So from a good management, fiscal responsibility aspect, if we're going to do an infrastructure bill, I don't know why we're doing it now. And so I think we can wait till the fall, wait till next year, wait to see how this 1.9 trillion affects our economy. It's going to have a lot of good aspects, but the inflationary problems that we're going to see across this country are staggering. They are staggering. If everyone has $1 billion to build roads over and above what they were already planning on spending, effectively doubling the number of dollars in the infrastructure, or if you pass this new bill, tripling or quadrupling it, you're not going to have the workforce. You're not going to have the asphalt. You're not going to have the concrete and the steel and all of that. The materials just aren't going to be there, right? The cost of wood, of lumber right now, it's 2 to 3 times what it was just a couple months ago, and that's going to keep going higher. Well, those real price increases are going to start hitting home to our citizens, our families, and our businesses across the country. That's very real. Look at oil. I mean, the cost of gas is already incredibly high. When you start building, another 2 million miles of roads across this country, the price of oil is just going to start skyrocketing. Eventually, everything kind of compacts on itself. So my message is this: we've got a lot of opportunity that was just passed. We're waiting for the federal government to figure out, to let us know how we're allowed to spend it. We know a little bit, but not really enough. Let's start spending those dollars first and then think about the next phase of infrastructure. Obviously, broadband, roads and bridges and clean drinking water, all those are really important things. And that's how I would spend those next dollars, but we can already spend that in this bill. And so we got our hands full right now figuring out how to spend this money. We don't need revenue replacement. We don't need bigger government and all of that. I know that's their mission, but we don't need that right now. We need those dollars on the ground. But let's figure out how to spend those dollars first.
Wanted to ask about, this has come up with a few questions in the chat that I think are all getting at kind of the same thing, going back to vaccine eligibility. Could you comment on and expand a little bit more on the out-of-state college student, where they fit into this, and not eligible right now, but is that coming down later, or what are your thoughts about that? A few people are asking for clarification on that.
So the federal government gives us vaccine based on our residence. They don't give me an allotment based on out-of-staters, out-of-state workers, out-of-state college students. If they did, then of course we would include them, but they don't give us the vaccine for that. So that's first and foremost. I have to make sure we're vaccinating our residents, right? How do I go to a 35-year-old mom and say, you got to wait in line because the out-of-state college student from Colorado has to come first? No, nobody thinks that should be the case. When you realize that most of the vaccine is a 2-shot vaccine, even if we started giving college students the vaccine today, most of them would get their second shot maybe in May, but most of them would probably even be gone before they even got their second shot. So we're not really protecting our communities anymore today by allowing them out-of-staters into the system. No state in New England right now is allowing out-of-state college students to get the vaccine. Most of the large facilities, the larger colleges and universities, a lot of them already have, like SNU or Dartmouth or others, most of their college students are already remote. So it's a kind of a bizarre argument to make that we should put out-of-staters before our own residents. I'm not given vaccine to do that. The federal government changes their allotment, then by all means, we would change that too. But I'm only given barely enough to take care of our own residents. And obviously they have to come first. The timing just doesn't work in terms of allowing out-of-state college students to be eligible. Now, if we get through our residents and everyone who's wanted a shot has signed up for it, well, then of course we can think about opening it up to out-of-staters. We'll ultimately have enough for that. And I think that would be a very smart thing to do. But right now, nobody's doing that. The feds aren't giving us allocation for that. And the benefits of it wouldn't even be realized until they've already left the state. So I'm not sure why we would ever consider doing that. It would be a real disservice to all of our citizens who have been waiting patiently for a year. Those college students are going to go home. Let's say the guy from Colorado is going to go home. He'll be home in mid-May, and he'll be able to sign up for a vaccine there. And by the time he got the vaccine and his antibodies built up and he's really protected and being part of that communal protection that we're talking about, he's going to be well out of the state anyway. So it just doesn't make any logical sense.
I want to go back to a question about, you talked about, I think it was in your opening statement actually, about all the different programs that Gopher has created to help different sectors. And a question came up about, how some of those programs have been targeted to the nonprofit sector, and that's incredibly important here in New Hampshire. And that helped many of them get through 2020. Some of them are still facing shortfalls in 2021. Do you see, with potentially the new funding that came in, is there going to be the ability to keep some of those programs going to continue to help those organizations that still need help through this year?
Yeah, so there's really two avenues there. First is a lot of businesses that took Main Street relief funds or whatever it might be, they didn't have the losses they were anticipating. So that money will come back to the state, right? They didn't have revenue losses. They thought they were going to be down 500,000. They turns out they were up 100,000 or whatever it was. And so, they can provide that money by federal rule has to get remitted back to the state. So we anticipate a few tens of millions to be remitted back in the next month or so, as we kind of hit tax season here. That Gopher money can then be reallocated. We can redo a Main Street relief program, or we can be a little more targeted with it. So there's, not $1 billion of opportunity, but I'm going to say $20 to $50 million of potential opportunity there to go back to some of those programs and reinstill them. I think with the nonprofits, we've already told them, don't send us any money back. Keep those dollars because you may have losses going forward. We may do another program for the businesses that are out there. There's a huge opportunity. The new dollars with the bill that was passed in December and the 1.9 trillion that was just passed about a month ago, there's a little bit of ability to do that in terms of revenue replacement or gopher type programs. Not a lot, but a little bit. Again, we don't have the final guidance yet, so we're not 100% sure. They're just not giving us the rules, and we're waiting with like bated breath to figure out exactly how we can spend it. So either way, there's going to be opportunity to kind of rebuild those programs. Not nearly as robust. The need isn't nearly as big, but hopefully cap off some of those areas, whether it's the small movie theaters or the music venues or things like that, the theaters that have been hit the hardest because those require people to be mass amount of people in together. Acts aren't wanting to come in right now, and hopefully that'll loosen up in the summer. But they've really taken, I think, the brunt of this more than almost anybody, or other industries as well. But we'll be robust, and we'll look at those opportunities and try to get as targeted of relief as we can.
So we have about 5 or 6 minutes left, and so I think it'd be a good time to start to wrap up. We got through a number of questions, so I appreciate everybody putting those through. So wanted to wrap up, Governor, with a couple more personal questions for you, just about your job and kind of future prospects. I wouldn't be doing my job if I didn't try to make news at a chamber event, especially when there's lots of people tuned in. So there's been lots of talk in the political world about you considering federal office at some point in the future, maybe the next cycle. Want to comment on that at all? Anything that you would share about kind of your consideration about running again, or oh, we're losing the governor? Oh no.
No, look, I everyone else is talking about it a lot more than I am. I don't know what to tell you. I got a lot on my plate. I got a budget. I got vaccine distribution. I got testing. I got schools to get back in. We're going to get schools back into 5 days a week in just a couple of weeks here. For those few that are remaining that aren't there, we just got so much on our plate. And I'm a big believer. I kind of ignored the campaign last time around because I just had a lot to do. And I believe that if you want to get elected to something, you got to do something, right? And so we just got to do. And then on those successes, if you decide you want to run for something, you can tout those successes and that experience. And if people want to vote for you, they will. And so I just try not to worry about the politics. I know other folks are fundraising and all this kind of stuff. It's March of 2021. I don't know. I'll make that decision in the summer.
Well, so to wrap up, I think a question that we've asked you at this forum before is just, sharing with people what your experience as governor is like. And I have to imagine that being in essentially a year-long public emergency changes the nature of the job considerably in a lot of challenging and stressful ways. Yes. But I wonder if it's also you've gotten to experience and see things and meet people who you hadn't met previously or interacted with previously. And I guess is there a memory or experience from just the past year as governor in this kind of emergency mode that has really stuck with you, that has something special, that has demonstrated something special about our state and our resiliency, and just that it had to be a fundamentally different experience than your first 4 years in office? Yeah,
no, it was massively different. Nothing I could have imagined. It was incredibly hard. I don't know a better way to say it. It was in a variety of ways, both the time we had to put in, the challenges that we were faced with, the mental aspect of what we were doing on the professional side, and just the mental aspect of our personal lives. I don't know anybody who wasn't affected, personally on this, and it was devastating in many ways. It was very lonely. People don't realize it. Nobody was here. You mentioned the people I come in contact with. We don't really come in contact with a whole lot of people over the last year. I think, I have 100 different stories that I could tell, to be honest, half of which I don't think I should ever tell publicly. Great stories behind the scenes. It was an election year. That was even more dynamic. So whether it was dealing with what was happening with the Trump administration, the transition to the Biden administration, dealing with my own election ultimately. But, I think the story I would pin on a little bit, and it's not a specific point in time, but it was early on when I realized, it's the value of working hard to build great teams in good times, and making good decisions in good times builds resiliency for the crisis. If you're not smart about what you do when things are easy, and you aren't willing to make tough decisions when things are easy, you can just kind of let the ideas, well, if we have a margin for error here. But making really tough decisions for the long term during good times allows you, for when the crisis to hit, you have the base, the infrastructure that is in the right place. And we worked very hard at that early on. I mean, not obviously anticipating a crisis, but where that gets me is the team. At the end of the day, I worked really hard to bring in good people and have a great team way before the pandemic. And so when crisis hit, we were ready. And it was amazing early on to see the core team, the Lori Shibonette, the general mecolitis, Dr. Chan, myself and others. That was it. We were making a lot of the decisions, and everybody was making those decisions based on data. They didn't care about the politics. They didn't care about, I said, we're all going to, I'll take the brunt. I'll take the brunt of the criticism. The buck has to stop here. I know that I have to make these decisions. But being able to lean on them and getting honest feedback in the moment for those moment-to-moment decisions we had to make was really incredible. And so if anything, it was, I don't know what the day was. I can't pick that. But there was a moment where I did have even in the midst of the crisis, when it was at its worst, I could take a bit of a breath and a sigh of relief and say, thank God I got these people around me. And thank God the people of the state have them, right? Really being part of that decision-making crew. And then as it branches out to the National Guard and the nurses and all those individuals that said, I don't care about the risk. I know what I'm doing is important. I know my job is bigger than myself, right? We all have to, I think, have that appreciation at times. And I'm going to stay in this long-term care facility with these individuals because their families can't visit them. And for a lot of these nurses, they were the only connection. And to see that play over time and time again, that was awesome. And that is why, frankly, we could actually sleep a little bit at night, because you knew you had individuals like that, not just on the front lines and not just here at the state level, but all across the state, doing everything they could. I mean, it was rare where someone said, I'm backing away from this one. I don't want to be part of this one. There were cases of that. I'm not going to throw names out there, but there were its fair share. But where it was needed the most, the people of the state stood up, and that was pretty awesome.
Well, Governor, we're right up on time. Thank you so much for spending time with us today. It's always great to connect, and hopefully our next forum will be back together in person in the future. And I know we always enjoy that. So thank you for taking some time, and we'll look forward to continuing to work with you in the future.
You bet. Thank you, guys. Look, just keep telling us what else we can do as more opportunity comes our way. We try to be very transparent, very accessible. You guys have been great, but just keep letting us know where those barriers are, and we'll just keep doing our best knocking them down. Thank you.
Thanks, Governor. I want to thank our sponsors, Dartmouth-Hitchcock Health. Thank you, Dr. Conroy, for welcoming us and being our presenting sponsor. Also, the team over at Eversource for being our corporate sponsor, and New England College for being one of our supporting sponsors. Thanks, everybody, for joining us. You can sign up for our State of the City on April 14th. See everybody. Have a great day.
Thanks, guys.